Good morning, ladies and gentlemen. I know Val is still trying to distribute names for those that don't know who they are. It's actually really for everyone else to know who they are. Can I welcome everyone to this meeting of Perth and Kinross Integration Joint Board? My name is Robert Peat, the chair of the Integration Joint Board. You're all very welcome this morning. Colleagues around the table, officers who are supporting the IJB, our visitors who are here to observe the meeting. We particularly have colleagues from Healthcare Improvement Scotland and the Care Inspectorate who are with us today and who will be here for a bit of time over the next few weeks. You're all very welcome to the meeting this morning. Could I just note for people that this meeting is being recorded, and if you feel you've missed anything, you can go onto Perth and Kinross website and look through the whole meeting in due course. Also, could I ask if you could put your phones on silent, or indeed if you would like to turn off your phones, that would be helpful for us. I'm going to tell you just a couple of things. One, we have a late item which will be dealt with under 6.4 of our agenda, which is in relation to 2019-20 Core Health and Social Care budget. So I'm sorry that's a late item, but important for us to deal with that this morning. Bernie Campbell is going to leave us at 12 o'clock. Xander McDade is going to leave us at 12:45. I hope all of us will be finished by 12:45. I suppose my aim, we'll see how we got on. My aim would be to finish by 12:30. If that's not too ambitious, but we'll see how we got on. Also, could I advise those of you who didn't see the press release earlier this week that we were successful in appointing a new Chief Officer and Director of Integrated Health and Social Care, Gordon Patterson, who will be joining us on the 1st of April. Delighted that Gordon has been appointed. Some of you may know Gordon in terms of other work that's been involved in. He currently works with the Care Inspectorate, but he has a long career in social work and social care. And what's really good about him starting the 1st of April is that Rob will still be here and there'll be a handover period, so I'm sure that will be very helpful, certainly for Gordon in coming into the role. And also could I indicate for the voting members of the IJB that there will be a brief meeting following this meeting, I think about half an hour. Okay. I hope I haven't forgotten anything. Just welcome to Paul. Goodness, I'm getting whispers. Sorry. Okay. Just one further thing, that we would like to take item 6.2 before 6.1. So 6.2 becomes 6.1 and 6.1 becomes 6.2. Okay. I think that's everything. Are there any declarations of interest from members of the IJB? Okay. Apologies. Thank you. I either miss apologies or declarations of interest. Last time I missed declarations of interest. Today I've missed apologies. Could you please advise us of any apologies that we have?
Chair, today we have apologies from Ms. G. Costello and from Dr. Carey.
Thank you very much. Could I take us to item 3, which is a minute of our meeting of the 30th of November? Could I take us through each of the pages if there are any points of accuracy, please? Which would be page 5, 6, 7, 8, 9, 10, 11, 12. That's just confirmed for me what I usually do at meetings and say, are there any points of accuracy at all, rather than go through each page. But there you go. So no matters of accuracy, which then takes us to the action points, item 4 of our agenda. Rob, could you take us through the action points, please?
Thank you, Chair. Starting on page 13, item 90 on the left, the timescale for this item is March 2019, so that's to come. The budget development session, again, will be conducted on the 13th of March as a development session. And then there'll be an IJB meeting on the 22nd of March, at which we will be conducting a number of matters of business, including budget and also strategic plan. Over into page 14, again you can see that the timescales of each of these items is outlined, and you can see that the strategy to support living and quality of life for adults with disability or sensory impairment is going to be brought to this meeting later by our colleague Claire Mailer. Moving forwards, again you can see that the page 15 outlines the programmes of care, which again are subject to being an agenda item today. There'll be an update, and there will be an opportunity to approve the terms of reference. And finally, the elements about progress on the strategic plan will be included in my report that comes up under strategic matters. The remainder of the items are resolved.
Thank you very much. Are there any questions that anyone has in relation to the action point? Okay. Thank you. We move on to any matters arising from the minutes? Haven't been covered in the action points. No. That moves us to the finance and governance section of our agenda, and our first report which we're going to deal with is 6.2, which is the 2018-19 Financial Recovery Plan. You have a copy of the report. Could I ask Jane if you would speak to the report, please?
Thank you, Chair. The Perth and Kinross IGB integration scheme sets out that where an overspend is projected, Chief Officer and Chief Financial Officer must take remedial action to prevent the overspend. Where that's not possible, they must present a recovery plan to the partners to address the in-year overspends. The recovery plan before you today summarises the work undertaken by the team, very much in partnership with colleagues in NHS Tayside and Perth and Kinross Council, to address the significant unanticipated level of pressures that we've seen in the financial year on social care, and the increased pressure that was beyond our prediction on GP prescribing. We have come forward with a range of measures in the plan that have been agreed that will not detriment service delivery and quality of care. Any actions that do relate to delivery of service have been fully risk assessed. At page 39 in the report and at page 41, the measures to address the overspend in both social care and health are set out. Based on those actions, the overspend forecast at month 8, 4.1 million, would be reduced down to 2.9 million. So this recovery plan does not resolve the underlying level of overspend, but it does respond to it. Our financial plan for next year requires to take into account all the underlying pressures and deliver financial balance on a recurring basis. It's important to note that the financial recovery plan actions within the report have been discussed fully and agreed with both NHS Tayside and Perth and Kinross Council, and by the Chair and Vice Chair of the IJB, and we now today seek a homologation of the financial recovery plan.
Thank you very much, Jane. Are there any questions or points of clarification that anyone would seek from this report?
Colin? Thank you, Robert. I think it is just worth mentioning that in terms of the recovery plan and the actions that were undertaken and that are ongoing, that yourself, myself and the Chief Executives of NHS Tayside and Perth and Kinross Council were very clear that we wanted to make sure that the impacts of those actions were fully assessed in terms of equalities and legal duties of the board, so that is an action that's a point which was raised and has been undertaken, and it's worth pulling that out in relation to this report.
Okay, Rob.
Thank you, Colin. And further to that, I think it's worth noting that there were some very clear principles set out in this. No detriment to people and no significant impact upon the core business of both the health and council services. So in other words, flow through acute care and so forth were seen to be extremely important, putting the needs of the population at the centre of this plan.
Thank you, Rob. Jackie?
Thank you, Chair. It's really just a point of accuracy in the report, in that as Chief Social Work Officer I considered the risk assessments and the equalities impact assessments and accepted those and gave advice on those. I don't think it would be for me to approve those, but I think if the report could be updated to say that those were considered and accepted by the Chief Social Work Officer and appropriate advice offered.
Thank you, Jackie. That's helpful. Okay. Eric?
Thank you, Chair. Yeah, I just wanted to pick up on Section 3 under Adult Social Care Services Mitigating Actions, and references made under Older People and Physical Disability Services, Learning Disability and Mental Health Services, Substance Misuse and other community services, where there are projected overspends which are not insignificant. The narrative behind the figures states that the demand in each area was not anticipated, and further adds that it is driven by complexity as opposed to increasing numbers. I just wanted to ask for some assurances in terms of looking forward from this point for the forecasts that we're going to come on to look at in due course for 1920 onwards, that demand levels, that we properly understand these, and that therefore we can give as much credence as possible to the forecasts that we're being asked to look at.
Thanks, Eric. Rob, are you able to answer that?
Yes, if I could just respond on, in broad terms, Eric, the unpredictability of the rise in demand is something that we have already discussed, and we're now looking at how we can use the intelligence that's available through our primary care colleagues and through our understanding of the population profile, particularly where there are complex needs within the population. We've had in this year the breakdown of some caring arrangements that have been contained within the family, and we're thinking we could do that better. We've also revised our understanding of the population growth, and we've revised that downwards, because the most recent figures demonstrate that the increase in population is only going to be about 8%, whereas before we were thinking it was going to be nearer 17%. So we've brought that down again, and our planning will bear that in mind. But if we look at the data, we can see that actually we managed to contain, for example, the number of emergency admissions into hospital. We've kept that stable, but what we've seen is a rise in the need for people in complex care in nursing homes, and also in an increased volume of care at home. So we are challenged to make sure that we are better at predicting these changes in service demand. So we have taken that on board, and we will be looking to join up our primary care intelligence with our understanding of the service that's required for people, in order to make sure that we have fewer surprises as we go forward.
Karen?
Thank you, Chair. Councillor Drysdale, you raise an important point, and in Perth and Kinross Council we have asked the Chief Officer to work with the Chief Social Work Officer and actually take forward a plan to review complex care and learning disability provision across the whole in Perth and Kinross, and look at alternative models. So we should be able to predict and look at where people are coming through the system and what support and care that they will actually need in the future, so we don't end up in a situation as we have done reported today.
Thank you, Karen.
Any other comments? I think it's important to thank everyone who's been involved in obviously looking at the recovery plan. Essentially any organisation, board, ourselves as a partnership, we would want to come within budget. It's obviously extremely challenging, but a lot of work has gone in to look at areas that we can actually find some savings. And I hope you'll appreciate that, I mean, you've known the situation with regard to the budget this year, and I hope you would appreciate that we had to come to an early kind of conclusion of this and actually agree the recovery plan, hence it coming to you today for homologation. So if I could take you to the recommendations, we're asked to note the projected outturn to month 8, although we'll hear in a moment the improvement in relation to that, and Jane has indicated an improvement. And as I say, to homologate the decision, you're asked to do that, and also, as I'm sure with the Chief Officer and Chief Finance Officer and other officers, will continue to seek all possible in-year opportunities over the remaining weeks of the financial year to deliver an improved financial outturn, and also for you to note the details of the recovery plan. Are you happy to accept those recommendations? Yes. Okay, thank you very much. Can I take us into item 6.1, which is the financial position in relation to 2018-19? And Jane, could you provide us with the update that you have here, please?
Thank you, Chair. Members will recall at the last meeting a forecast overspend of £4 million for the IJB. The forecast in this report today forecasts an overspend of £1.954 million, therefore a significant improvement. Of course, within that are the financial recovery plan actions that we have just discussed, which amount to £1.2 million. So the £2.1 million improvement since the last report, of that £1.2 million relates specifically to the recovery plan actions. We are assuming that these will be delivered, and the work is going on to implement all of the actions across the services, and obviously there's a risk attached to that forecast, but we are confident that the assumptions we're making about delivery of the recovery plan forecast can be delivered. Over and above that, we have an underlying improvement in the position. And as Robert concluded in terms of the last paper, that's a result of all the work that we're doing to do everything that we can to drive down the costs and move towards an improved year-end position. There's three key areas where we've seen an improvement since the last report. We are actually seeing an underlying improvement in our complex care position over and above that set out in the financial recovery plan. We're seeing an improvement in our GP prescribing position, and I'm slightly reluctant to wave any flags around that because it is notoriously difficult to predict the GP prescribing position, and we often see it improve one month and deteriorate the next month. But we are grateful for that. For now, we are seeing a £400,000 reduction in forecast overspend in GP prescribing. And finally, within elderly services within our health teams, we've seen some slippage, some significant slippage in our proposed investment in some of our front door and frail elderly new models of care, and that non-recurring benefit has also significantly improved the financial position. So a positive report does reflect the financial recovery plan actions, which yes, still have to be delivered, but reflects a significant amount of work being done across the team to try to drive the position towards financial balance.
Thank you very much, Jen. Are there any questions? Yes.
Yes, thank you. Reference is made to the recovery of prior years' surpluses from providers. It's just a point for consideration that individual circumstances for the third sector is that we face quite often limited and dwindling reserves. With that actually can impact on our ability to attract external funding into Perth and Kinross, additional external funding, because of appearing to be unsustainable organisations where trusts like the grant people like the big lottery won't award funding bids because of the appearance of being unsustainable. It's just that for that to be taken into consideration. For individual circumstances, for some third sector organisations, I mean, understandably, where recovery can be done, it has to be done.
Okay, thanks for those comments. Any other? Rob?
Perhaps I could just respond to Claire. I just want to assure you, Claire, that from the point of view of the IJB and in our service redesign challenge that we have ahead of us, the third sector is a very important partner in this. And as we redesign, our philosophy is based upon moving whatever we can to services that are close to people. And as we look at anticipation, early intervention and prevention, we know that that is a very important feature of our purpose for the future. In other words, to stop our concentration on, if you like, failure demand, picking up the pieces after people have already got a problem, and looking very carefully at how we can intervene early in order to make sure that people have the best chance of avoiding the avoidable consequences of ageing, illness, etc. So, thank you. Just to assure you that that is not lost.
No other questions? Comments? Okay. We have recommendations really for us to note the situation and obviously the paper that we've already considered with regard to the recovery plan, and clearly for us to note the progress on the savings. And we have said in the recommendations about the IJB reserves, but they're outlined within the report. Clearly from the last time we met, I mean, it's positive to see this change. Obviously it remains a concerning situation, but we'll see where we get to with the end of March with regard to the budget situation. So you're happy to accept these recommendations? Okay. Thank you. It takes us to item 6.3, which is a verbal update from Callum with regard to the Audit and Performance Committee.
Thank you, Chair. We haven't had a meeting since the last meeting of the Integration Joint Board. Our previous meeting was immediately before that. The next meeting of the Audit and Performance Committee will be held on this coming Tuesday, which is the 19th of February. As I've spoken about before, we've been looking at ways of trying to make the discussions at the committee more meaningful and ensuring that we have recommendations that will be followed up to try and improve our performance and ensure that we have assurance that the services that we provide are being done so appropriately. One change that we have made to try and allow as many people as possible who want to contribute to the discussion to come along to the Audit and Performance Committee is now that any member of the Integration Joint Board will be able to attend and participate in addition to the joint members. You have had an email inviting you all along to that meeting, and I would encourage you either at the next meeting or any meeting where you feel you have an interest or something that you can contribute to that discussion. We would very much welcome your attendance to ensure that we have the fullest possible debate and discussion about any of the issues that are coming forward. I'll just quickly run through some of the things that we're going to be discussing next week by means of an update. One of the things that we have now included in the terms of reference, which was a bit ambiguous about where in the IJB was responsible for, is complaints and FOIs and various other corporate performance targets and how our performance is doing in those areas. There was not a formal reporting mechanism on that. So we now have the first corporate performance report that will be coming to the Audit and Performance Committee at the next meeting. So that's as soon as we approved the terms of reference at the last IGB, we now have the first report coming forward on that. One of the concerns I had, and I think others had raised as well, is that there was a lot of focus on the audit side of audit and performance, but not quite so much on the performance side, which is obviously pretty fundamental in terms of an organisation that is delivering services. So as you now know, we have our 4 boards for the different programmes of care, and at the next meeting we will have the first performance update for the Older People and Unscheduled Care Board, which is quite a weighty document, which I would encourage you all, even if you're not coming, to have a look at and to read. And we will go through that and look at how we think the performance is doing and make any recommendations that we see fit on that. At a discussion at the last Audit and Performance Committee, there were some concerns raised about some of the things that came out of the inspection of Perth Prison, and why the Audit and Performance Committee or the IJB was not made aware of these concerns earlier on, because as we know, self-evaluation and other things were ongoing with officers, but at no point were board members made aware of that, and that was certainly a concern that I had, and some other board members did as well. So at the last Audit and Performance Committee, we brought forward a new risk framework and the risk register, and the conclusion that we decided was that we would ask that that risk register come to every meeting of the Audit and Performance Committee, so we can monitor performance and ensure that any problems that arise are brought to us at the first opportunity. But we did ask, in addition to that, if there's anything that is very significant over and above something that could be reported at our meetings, it's about 6 times a year, that be reported to board members at the earliest opportunity. We also have a number of other reports, and we have the report from the Chief Social Work Officer, which is also being discussed at the Integration Joint Board today, so we'll perhaps go into a bit more detail on that at the Audit and Performance Committee, and we also have the audit strategy from KPMG and our internal audit progress report. There's also 2 other bigger reports that we're going to be looking at that have come forward from national bodies. So Audit Scotland's report on health and social care update, and the progress that has been made in that area, which I'm sure has already been circulated to members. I'm sure some of you will have had a look at that. What I have asked, we'll have an initial discussion on that, but I've asked for the recommendation to be that we ask officers from the IJB to look at that report in detail, as I'm sure they will already be doing anyway, but to look at the applications from the findings in that report to the Perth and Kinross IJB. And we also have a report, as has been discussed earlier in the briefing session earlier on today, on the Ministerial Strategic Group for Health and Community Care, their report on the review of progress into integration of health and social care, and we'll be looking at that and the implications for the Perth and Kinross IJB on that. So just to reiterate that anyone who wants to come along is more than welcome to do so, and I would like to have as a constructive and informed discussion as we can, and to ensure that the Audit and Performance Committee continues to do a better job than perhaps it has done in the past.
Callum, thank you very much. If you haven't been to the committee, I think there's a very good advert for it. So please, if you're able to come along next week in any of the future meetings, I think you'll find them informative and interesting, and actually fundamentally important for the work of the IJB. So please do come along. Are there any questions anyone has of Callum at the moment? Or you could perhaps hold those for when you come next week. Okay. Thank you, Callum. We're going to move to the additional item 6.4, which is the 2019-20 Core Health and Social Care budget. As I'd said earlier, I mean, we've already heard about the situation this year, the financial position and the recovery plan. Obviously, huge amount of work has actually been taken forward to date and continues in relation to future planning. And there are additional parts of the paper just coming round, so I'll allow those to go round, and then we'll continue to look at the paper. Everyone has a copy of the additional page, Appendix 2. Yeah. Jane, could I ask you to take us through the report, please?
Okay, thank you, Chair. First of all, can I apologise for the lateness of the paper. This is the first year in which the IJB are being asked to approve a requisition to the parent bodies. I think each year we have been learning the lessons of the previous year, and I think we are now much clearer and in line with the core requirements of the integration scheme in the IJB in bringing forward this budget requisition. Just to be clear, section 9.15 of the integration scheme sets out that both partners will consider the IJB's proposed budget requisition through their budget setting processes and will confirm the actual budget requisition to the IJB the day after council tax legally requires to be set each year. So we are, for the first time, complying with those requirements. However, This is not for the full budget of the IJB. This paper before you today relates to what we would regard as our core health and social care services. At this stage, it excludes GP prescribing and it excludes inpatient mental health services. They will require to come forward separately as part of separate papers coming forward with all going well at the March meeting. The budget requisition that we're bringing before you today, and we've circulated the separate appendix which sets out the total budget requisition from both parent bodies, results from a significant amount of work done across core services to set out a 3-year financial plan, of which before you today is the outcomes for year 1, 1920. The financial plan has undertaken a robust review of pressures and has linked very closely with the programmes of care to understand the core essential service investment required to deliver the aims of the strategic plan. We've then looked at the efficiency and disinvestment opportunities across the 3 years, and across the 3 years we're looking at delivering £7.1 million of transformation and disinvestment, of which for this financial year 2.6 million is proposed to be delivered. Our draft financial plan and the pressures and savings within it have been subject to a very detailed and intensive scrutiny by our IJB budget review group process, which has challenged us around all aspects in terms of the momentum that we're applying to delivery of our savings, in terms of the innovation that sits at the heart of our proposals, and indeed bringing their own proposals to the table for discussion. So what's before you today and what supports the requisition itself has been a detailed process by officers, a significant challenge by the budget review group. The conclusions of that are at table 3 in the report, but are supplemented by appendix 2, which has been circulated. If I can take you through appendix 2, the recurring budget for the for core services for this financial year totals 93.7 million, spread across adult social care, hospital and community health. The financial plan, including pressures and savings, would see that being increased by 8.6 million. There is a slight nuance in there in terms of within the health, a small over-delivery of savings when we look at health side alone that has been ring-fenced, whilst we await the further work we require to do on our wider health budgets. So overall, the budget requisition that you are being asked to approve today would be a 48.381 million requisition to NHS Tayside and a 54.54 million budget requisition to Perth and Kinross Council. From an NHS Tayside perspective, we don't have a formal response to that at this stage. The financial plan for NHS Tayside will go to the board on the 28th of February, but from discussions with senior officers and including the Chief Executive, the budget requisition for NHS Tayside is in line with the funding assumptions in their financial plan. For the Perth and Kinross Council budget requisition, the papers that will go forward to Perth and Kinross Council at its budget meeting next week have taken into consideration the pressures and savings that we are facing. But the council itself is facing an extremely challenging financial position, and has set the based on the draft papers that are going forward, which are still subject to discussion next week, has set the IGB a further challenge to deliver of a £2 million additional saving. So as things stand at the moment, there is a difference between the draft position that is in the Perth and Kinross Council's papers and our budget requisition of 2 million. However, the Perth and Kinross Council meeting next week will need time to consider that fully until we have a formal position. In the meantime, and in line with the integration scheme, it is our responsibility to put forward the requisition to both parent bodies based on our assessed need of delivering the strategic plan, and that's the decision before the IGB today.
Thank you very much, Jane. And Jane, can I thank you, Rob, and all your colleagues for the huge amount of work that actually you continue to do with regard to the preparation of not only next year's budget, but the next 3-year budget. And also to Callum, who has led the budget review group. Callum has been extremely diligent, has dedicated a significant amount of time to actually leading that process. And I think on behalf of the IGB, it's important to thank you and other colleagues for the work that you've done. Callum, would you like to say anything in relation to the paper?
I can do. I gave a full update at the briefing session which we had on the financial position beforehand, but I'll just give a summary here at the public meeting. The Budget Review Group has intensely scrutinised the proposals that have been put forward by officers for expenditure and savings in the form of executive summaries that have been put forward, detailing the outcomes and the implications of any of those savings and pressures that have been put forward. What's underpinning the budget is a significant transfer of funds to community investment, and one of the major things that we're bringing forward is enhanced community support, respiratory care models in the community, and also looking at rehabilitation and intermediate beds, which will allow us to disinvest in the bed base in the wider Perth and Kinross and across Tayside. So we have looked at that. As Jane has outlined, we're not setting the budget today. That scrutiny process from the IGB has allowed us to form a position on what we think the required requisition should be to the parent bodies. We've gone above and beyond the proposals that were put forward by officers, and we've come forward with at least an additional £1.3 million of savings in the first year, as we're cognisant of the pressures that our parent bodies are facing as well, and we wanted to do what we can to try and assist with that situation. Some of that will be in the form of rephasing savings, so we're looking at, given that it will take some time for the enhanced community support to begin, rephasing that back so that we are able to fully implement that when we start it, but also to make the disinvestment at the same time, because some of the disinvestment in workforce and management and administration costs were to be delivered over 3 years. So we've looked to try and take that and do the investment and the disinvestment at the same time. There are still a number of additional proposals that we are looking, including rephasing of savings and potentially some changes to charging, which we will be discussing both with NHS Tayside and with the Council, and officers in the IGB are continuing to look at that. So we may be able to bring forward a better position than perhaps we have, and that will help us with the £2 million gap that we still have on the Council side. And as Jane has indicated, that although through the IGB BRG process we've been able to over-deliver on the health side, that might be needed to offset some of the pressures in terms of hosted services and GP prescribing. And as I think you'll come on to in a minute, Robert, the IGB BRG have come to the conclusion that we'd like to make a few additional requests of our parent bodies to assist us in making sure that the budget process is done properly and that we're able to deliver on our role under the integration scheme as they are on theirs.
Thank you very much, Callum. Are there any questions? Karen?
Thank you, Chair. So a couple of observations. Firstly, on behalf of Perth and Kinross Council, can I also add my thanks? I think we've reached a much more mature stage in terms of the budget process within the Health and Social Care Partnership, and we certainly welcome the fact that we've now got much more clarity on the pressures and indeed the savings that are being proposed. Because we have members in our audience today, I think it's important that we clarify what we mean by budget requisition. So the requisition is not an order to the parent bodies, it is simply a request that will be considered at full council on the 20th of February. I think it's also fair and for the minute to record that there is an officer recommendation that accepts all the pressures and savings coming forward from the Health and Social Care Partnership. It is now a matter for full council to decide on the budget setting process. That said, I think we all recognise it's a significant proposal coming forward from officers around funding for the Health and Social Care Partnership, with a 10% cash increase being proposed. In contrast, we're actually looking at a 3.5% reduction in every other service area across the council, and I would like that to be noted. Jane, thank you for noting the £2 million efficiency saving target that the council would like to see as part of their budget recommendation. So that's 2 million this coming year, 1 million the following year, and 2 million the year after. And the final point I'd like to make is that you have already heard a commitment in the briefing session from both the Chief Exec of NHS Tayside and myself to work together to get clarity on the set-aside budget, and the Ministerial Strategic Group recommendation that 50% of that should be reinvested in the community within 6 months. So I hope that that will have a positive impact on the Health and Social Care Partnership budget in due course.
Karen, thank you very much, and we certainly appreciate the commitment and support of Perth and Kinross Council, and we look forward to the proposals being agreed by the Council in the coming few weeks. Any other comments from Eric and Sander?
Thank you, Chair. I'd just like to put on record my thanks for the continuing efforts of the executive management team of the Health and Social Care Partnership, and also the new chief executives of both NHS Tayside and Perth and Kinross Council for the focus that they're bringing to efforts to balance the books going forward. What I would just like to make a plea to everybody that is involved in this process now and going forward, and I know that everybody buys into this. We're talking about numbers. We're talking about a blizzard of numbers that those of us who do not live and breathe this stuff week in, week out will be bamboozled by. But I just wanted to ask for a statement, if you like, from yourself, Chair, on behalf of the Integration Joint Board, that actually what this is about improving and transforming services and delivering the services that our population is entitled to expect going forward. And that our challenge is to be able to afford that, but the priority is the provision of the services.
Thank you very much, Eric. Sander?
Yes, thank you, Chair. I just wanted to sort of, similar to what Councillor Drysdale said in terms of recognising, and also what Councillor Purvis said, about how much more robust this process was, comparative to last year. I think the BRG process has been incredibly robust. I think actually, from my point of view as a board member, and with our NHS board members as well, we've actually found a lot more common ground, I think, and I think we have a much clearer direction of where we want to go, and I think a much greater understanding of what the proposals are ahead of coming forward as papers. And I think, from my point of view, it's been a very helpful process for that. And I think we should also recognise, as Councillor Drysdale said, the support that the Council and NHS chief executives have been playing in this, and we're grateful for that, because we are still a very new entity on a learning curve. But I think there's the difference between this last year and this year is enormous and can't be stated enough, I think.
Thank you, Sander. No other comments? To reiterate what's been said, I wasn't a member of the IGB last year in terms of the process, so it's my first experience. I'm pleased that it's a more positive one, but certainly it's been the support that's been given from the officers and colleagues in the IGB has been hugely helpful, and the personal kind of commitment that's been given from Karen, I know now Grant, and in terms of their still a new role, Karen as Chief Executive of the Council. I'm not sure if it still feels like that, but certainly Grant, and we had the opportunity to have Grant here earlier in terms of a briefing session, and both, as Karen said, both stated their commitment to continue to support this process. And I think, as Eric says, the work that we carry out within the IGB, the partnership, is supporting people who can be vulnerable for a whole range of reasons. Older people as they get older and frail and experience Alzheimer's disease, the support that families require in individuals with learning disabilities, mental health issues. We know that that's a particular challenge, obviously, across Tayside, and as we host that service. But people within Perth and Kinross rely greatly on the services that are provided by the Health and Social Care Partnership, and it's important that we continue to support those as well as we can with the resources that are available, and through a process of change and transformation, adopt new ways of working and actually new ways of becoming more efficient and continue to provide high quality services within the resources that are available, and that will always be a challenge. But I think our staff demonstrate that they're prepared to meet that challenge, and certainly we await the outcome of the budget setting processes, but certainly we'll continue to provide the services in a dedicated way into next year and the years to come. There are, as Callum said, I think there are maybe some points that we would like to add to the recommendations just to assist the process, and I think for some clarity about our expectations as to when the budgets for the Council and NHS are being set. I think we would like to add a couple of recommendations that acknowledges the improvement in the collaborative working that there has been, but actually to further enhance that, and also really to look at I suppose the risk sharing agreement, and there are other ways of actually addressing that, and I think we would find it helpful if these were added to the report. A motion has been passed around. I'm advised that that's what this needs to be in terms of the additions to the report. So I'll give you an opportunity to read those, and hopefully you'll be able to support those in terms of additions to the recommendations to this report. So if I can give you a few moments to do that, and would like to propose this motion, and I think to be supported by Colin in relation to that.
Everybody's got it and absorbed it or started reading it. So I think, thank you, Robert. I think first of all, like my colleagues who were on the budget review group, I'd like to recognise the significant efforts that Callum put into that. I do think that it was a significantly more intensive and process than I had been led to believe there was in previous years, and as a consequence of that, I think that we should significantly recognise the efforts of Jane and her team, the finance colleagues that were being asked to provide a lot more detailed information and a lot more reviews, information, and to answer the scrutiny and the questions from the budget review group. I think that was the process is ongoing, but I think it was quite a learning curve for everybody. I think what is particularly positive about it as well, though, is that we're now looking forward to a much more robust 3-year financial plan rather than a 1-year financial plan. Certainly, when we look forward to next week, we've got the Council's budget setting meeting. On the 28th of February, we've got NHS Tayside's budget setting meeting. That's for its 1920 budget, but in April, the board is also going to be looking forward to a 3-year financial plan. That means that we are taking a longer term view, and we're being able to then provide more stability and more detail around how we can properly invest in the areas that we need to invest to shift the balance of care. I think certainly from the budget review group or the board's perspective, one of the challenges that we'll be putting in front of officers in terms of the development of the strategic plan, which the financial plan will have to match up with, is to look not just at the the coming year or the coming 3 years, but what investments we can make now that will pay dividends in 5 or 10 or 15 years. I think we need to be conscious that with a nascent organisation like the Integration Joint Board and the Health and Social Care Partnerships, the forward look so far has been limited. The Health and Social Care Partnership has been coming together, but I think that in future we certainly need to take a much more long-term view. Just to pull out some of the points that are in the document that's been circulated for everybody. We do need to formally approve the requisition, I think as was mentioned earlier, to both the Council and NHS Tayside as outlined by the Chief Financial Officer. We should note that both parent bodies are required to confirm the formal requisition to the IJB by the technical wording in the integration scheme is the day after the council tax legally requires to be set. For this year, that is the Tuesday, the 12th of March. We do need to note the Perth and Kinross Council Officer recommendation for the Budget Officer to the IJB for the 2019-20 financial year, and that the Council's final budget settlement will be determined, as I said, at its budget setting meeting next Wednesday, and that the NHS Tayside budget setting meeting for 1920 will be on Thursday the 28th of February. The additional points that, just to draw those out that were being referred to, specifically we would like to request that NHS Tayside provides the IJB with the necessary financial information, particularly in relation to hosted services and GP prescribing, to allow us to fulfil our responsibilities in line with section 9.15 of the integration scheme, which are to provide direction to the partners before the start of our next financial year regarding the functions that are being directed, how they are to be delivered and the resources to be used in delivery, and we would like that information by Tuesday the 12th of March to support our budget setting process. Our final budget setting process, the meeting will be on the 22nd of March, so there will be a gap that once we receive the information we can develop into our budget. We're going to ask Perth and Kinross Council and NHS Tayside to work with officers from the Health and Social Care Partnership to facilitate an even more collaborative IJB budget setting process for the following 3-year budget, 2020 to 2023. And we're going to request Perth and Kinross Council and NHS Tayside to review the risk sharing agreement for the Integration Joint Board to provide clarity to the board about how potential IJB overspends, and I would emphasise the word potential, will be dealt with in the future.
Thanks, Colin. Are there any questions in relation to the points that have been raised? Lorna?
It's not a question, but I like, Colin, what you'd added into the point 5 there, to facilitate an even more collaborative. I think that wording would be helpful. And the motion by yourself, Robert, and by Colin as Chair and Vice Chair of the IJB. Thank you.
Thank you, Lorna. So you're happy to accept the recommendations within report 6.4 with the addition of the points that have been distributed to you this morning within this motion? We're happy to approve these? Okay, thank you very much. Which moves us on to section 7, developing strategic objectives, and our first report is 7.1, which is Rob's title of the report is really the Chief Officer's strategic update. We haven't become so informal as to have Rob's strategic update. Rob, would you like to speak to your report, please?
Thank you very much, Chair. For members, just to state the position, the purpose of this report. This report is to keep members of the IJB and wider parties informed of some of the ongoing matters that don't quite get to the point of being formal proposals to the IJB for decisions, but update to members of the IJB on topics that we have within our interests in delivering services here in Perth and Kinross. So in this update, I have 3 topics that I have chosen to bring forward. The first one is to update the board on our progress with winter planning. Again, we discussed this at the last board, but NHS Tayside has been commended nationally to have one of the most sophisticated health planning processes for winter planning. And this year we worked very closely with colleagues in the council to try and bring together planning around our population's needs. And we have a stated intention to try and do that even better as we go forward into the future. So considering some of the metrics by which we decide how well we're doing, we keep an eye on the performance of our hospitals and of our services. And I'm pleased to be able to say that in general terms, since the winter plan has been put in place, there has been an overall improvement in the level of people who are flowing through our health and care services. We have, in just the last few days, seen a slight rise in the number of people who are suffering delays in discharge, but overall we've pretty much halved in the last year or so the number of occupied bed days. That those are the numbers of days that people sit in a hospital bed awaiting a journey back home. So we've something like almost approximately halved that number of delays in comparison to previous years. The challenge remains. People within the board will be aware of the fact that we do have some challenges around finding sufficient care at home hours, and the demand for that keeps going up. However, again, colleagues across both health and care have been working very hard to minimise the impact of that, and the impact of the heart team in particular has been seen this year. So this was our decision almost a year ago to make a new team that would oversee the journey between hospital and home, and who would prevent people being admitted to hospital when that was avoidable, or indeed to a care facility. I'm happy to respond to any particular comments or questions there might be about the winter plan. I have colleagues with me who are aware of a little bit more of the detail.
Drew?
So, thank you, Rob. Not a question, just really to confirm from a public health perspective what you've just said in relation to not only has the plan been commended, but it's proven its worth, and it has made, I think there's a general acknowledgement that the planning process was much more collaborative and productive this year, and the way that the challenges that we face over the winter months has been much more productive and collaborative in previous years. So a big thank you from NHS Tayside to all of our partners that have been involved in making that happen.
Thank you. Yes, we have a very joined up approach to resilience planning here in Tayside, and colleagues in the council are thoroughly involved in that, and we're just seeking to make that as coherent as it can be. If you wouldn't mind, I'll move on now to talk about our joint inspection. You'll see outlined for you in my paper the programme which today we're privileged to have with us members of the Health Improvement Scotland and Care Inspectorate team who are observing our meeting today. But you can see at section 3 and in 3.1 and 3.2 an outline of the timetable of events that are happening. So we have already started our process. We had a staff survey that's gone out to about 2,000 people, and we will be getting the results of that as we start the first fieldwork event on the 25th of February. I had the privilege of speaking to the inspectors. This is a new matter in the inspection process that has come because of the recommendations of previous inspections held in the previous 5 events across Scotland. So I had the opportunity to speak to the inspectors about the context of the partnership, and that was an extremely productive meeting where they exhibited a huge amount of interest in the work of the partnership. They were kind enough to comment on the drawing I put on my whiteboard that tried to describe the journey we've been on as we've sought to take the foundations that had been built in partner organisations and to sew together the purposes of the partnership around a more integrated offer to the community of health and care, because there is such an interdependency between the different elements of service. Our third sector providers, our independent contractors, the many people who provide services for us from the private sector providers delivering health and care interventions here in this area. We have prepared for the inspection 2 documents, one of which is for our own benefit, actually, and we were looking to evaluate our progress on the journey. So we have a self-assessment document that has been evidenced by something like 1,600 pieces of evidence that demonstrate the level of work that has gone on across the partnership and within the last 3 years of our work together. However, that's an awful lot for the inspectors to digest, so within the process there is a position statement that we have to produce, and this covers each of the quality indicators that you see set out at 3.4, again with references to evidence. So we now look forward to 2 fieldwork events, starting first of all the week commencing the 25th of February, that's a week on Monday. That will begin with a presentation to the inspectors and amongst an invited audience of leaders within our partnership. The inspectors then will go through a process of meeting with people who actually deliver the services. And it's been stated at the very beginning that we need to know how good we are at what we do, how well we're progressing on the journey towards delivering planned and properly commissioned services for the people here in Perth and Kinross. That week of inspection will be very busy, and I want to pay tribute to Fiona Easton, who's been working on our behalf to hold together the planning for these events and to be the conduit through which communications have happened. The week commencing the 18th, there will be a further 2 days in which the inspectors will be speaking to the chief executives, to myself and various others in order to have that personal conversation about our own experience of the journey. There will then be a discussion event on the 5th of April, and the final presentation will be given to us on the 15th of May when the report stating the inspectorate's view of our progress will be made known to us. Again, I'd be very happy to respond to any questions if people would like to ask. Okay. So the final thing that I have in my update this meeting is just to talk to you about the refresh of the strategic plan. We are due by the end of this financial year to be in a position to present a new iteration of the strategic plan for the Health and Social Care Partnership here in Perth and Kinross. This is a document that is owned by the IJB. This is a document that we bring forward for approval by the IJB, and it will not supersede the first strategic plan. It will build on the first strategic plan because there are many aspects of the first strategic plan which remain valid to this day. We've tested that at a meeting in March of 2018, and we've been working with stakeholders since in the development of this document. We've been advised, and looking at other partnerships around Scotland, to follow a pattern that simplifies and makes more clear the outcomes that will be expected in this next phase. So the discipline will be, and is being, an attempt to bring together the work of these 4 strategic programme boards together: older people in unscheduled care, mental health and well-being, primary care, and carer support. And as I stated in the earlier meeting, there has been a significant amount of work to join up the thinking about the strategic planning for the IJB with the wider plans for both the Council and the NHS. And in fact, on Monday, I will be working with colleagues from NHS Tayside to make sure that the Transforming Tayside plan and the Integration Joint Board's plan for Perth and Kinross have solid connections. So this would be seen in the way people flow between acute care in PRI or in Nine Wells and in and out of acute mental health services, learning disability services and so forth. We're also going to be recognising the fact that there are significant interdependencies in some of our services. So for example, in our prison, we've talked about the fact that there are approximately 700 people, a large proportion of whom deal with issues of substance misuse or who have issues of mental health. And when this document is concluded, we will need to be able to set out bold ambitions for the future. But as we've discussed, we need to make that realistic and affordable within the financial plan. So we did have a debate about whether we cut our ambition to the resources that are available. but we decided absolutely not. We need to maintain bold ambitions for the future, recognise the opportunity that there is to change the way in which services are delivered, to enter into an honest and a transparent discussion with our population about the changes that need to be made, and to be very clear about what it is that we as a health and social care partnership will be offering into the future. And while I will not be leading that after the end of April, we want to set a legacy for the new chief officer coming in, and we also want to make sure that we stick to the very key principles that were set out for us in the 2014, 15, 16 Join the Conversation exercise, where 4,000 people stated very clearly what they expected health and care services to deliver for the population here in Perth and Kinross. I have a slide that you'll see up on the wall that sets out the timetable as we see it. And that just shows you that we are in a process of communication. We're using our community engagement team to speak to the populations. We are taking this to the Tayside board and through PKC. We will have an IJB development session on the 13th of March that you've heard about in relation to the budget, but we will also be discussing the strategic plan. The 14th of March, the public consultation concludes. Then our statutory obligation to having a strategic planning board will see the conclusions of all that information brought together, and a final decision will be made at the IJB on the 22nd of March around approval for the plan. Obviously, board members will be kept informed, and we will be distributing the draft plan to everybody so that they can take their part in shaping it for the future. Thank you.
Thank you, Rob. Any questions, Sander?
Thank you, Chair. Yeah, I'm slightly concerned here in terms of, Rob, you said that we've had a debate about basically what's going ahead in the strategic plan, but so far the board has had no discussion about what's going to happen in the strategic plan. The board has changed significantly since the original strategic plan was set, and I have to say I think we've had a very good cooperative BRG budget setting process, and out of that a lot of strategic priorities for the next 3 years have come forward, but that is priorities of the new current board and does not necessarily reflect what the original strategic plan said. And I'm quite concerned that the proposal is that we are to be consulted on the 13th of March, basically after everyone else has been consulted, given that the IJB owns the strategic plan and really should have been consulted as the first starting point, so that what is going out to be consulted on is basically the general broad vision that the IJB is setting. So, you know, I'm quite concerned about the timescale you have just set out and the fact that we have not been consulted, and basically we have 6 weeks to have a strategic plan agreed for the next 3 years.
Thank you, Zander. So the strategic plan will be based upon the programmes of care that we've been discussing in the IJB for the last few months. It will also be brought forward as a document for members to see within days now. We're just at the process of having received some comments. Unfortunately, because Diana's been away from work, we've had a little bit of a hiatus in managing some of the tasks of the last few days. But I will assure you that we will be bringing that document to the attention of the IJB members next week.
That may be the case, but I don't really think it helps us in terms of actually setting out what the strategic direction should be. If we've not had a discussion about it before this document has A, been drafted, and then is B, going out for consultation, we're not due to meet until now the 13th of March for this development session. And I really think, actually, in terms of timescale and planning, we should have been consulted much earlier. And, you know, in terms of the strategic direction, we have, as I said, had a very positive set of discussions through the BRG process, where I think for the first time the councillors, the IJB, NHS Tayside board members have all been working as one effectively and on a very shared vision. And I don't particularly, you know, think we should be losing that. I think we should be using that and building on that, and I don't necessarily think that's reflected in this process.
Accept your comment, and obviously I'll work to make sure that that information is brought forward as soon as possible.
Eric and then Callum.
Thanks, Chair. Just following on from what Zander has been speaking about, my concern, and I think Zander's concerns are valid, but I would also add that that we have a situation here where we have an independent inspection that will report, as I understand it, on the 15th of May. So our strategic plan is not going to be able to take into account their thoughts and findings. And I guess my question is whether there is a legal / statutory imperative to have this revised strategic plan in March, or whether, given that issue and given the financial realities that we are facing, whether there is some merit in delaying the approval of the strategic plan to a future meeting, either in May or June.
Karen, would you like to make a comment?
Thank you, Chair. Again, Councillor Drysdale, it's getting a bit worrying that I'm agreeing with all the points you're making this morning. However, I do agree with the points that you've made, and indeed to Councillor McDade. I would suspect that if the Chief Officer were to provide a draft plan, and I can't speak on behalf of Scottish Government, but you have a new Chief Officer and Director of Integrated Health and Social Care about to come in, who I would imagine would want to have a view and support the IGB in terms of taking the strategic vision and direction for the partnership forward. I think it would be very wise to take account of any recommendations and improvements from the inspection process. So it may be that a way forward is for you to speak with Scottish Government to issue a draft strategic plan, bearing in mind the 2 points that I've just made around the new Chief Officer and Director, and indeed the comments from the inspectors. I would hope that there's nothing in the inspectors' recommendations that the Health and Social Care Partnership are not already aware of.
Thank you very much for the suggestion, Karen. Xander and Eric, would that help to kind of deal with the concerns that you've expressed if we move forward on that basis, if we have the agreement with the Scottish Government? Callum, you would like to comment?
Yes, I agree with the comments of the three previous speakers, and Councillor McDade's comments are very much the ones that I would have intended to make as well. I think, Rob, we've had discussions before, and we've had discussions at the board about, particularly in relation to our role as board members, is to give strategic direction. You can't get much more strategic than the strategic plan, would be my suggestion. And I do think that the process has been wrong, whereby we should have been starting that process, at least having an initial discussion about what our views are. Councillor McDade makes some very valid points about the change in the makeup of board members, and I think that we might have a different view about how we see the partnership going forward. I absolutely take your points about the 4 programme boards, which we have all as accepted and agreed to in previous IJB meetings, but I think it's a more fundamental discussion that we as board members, all board members, both voting and non-voting, have to have a discussion about what our priorities are. And I am concerned about that timescale that we're talking about, between the 13th of March and the 22nd of March, having to approve that. So if the current draft could be circulated to members as soon as possible, but I do think there's a wider issue here which we need to look at in detail going forward, and as I have raised before in relation to other things like the corporate identity. We had a discussion recently which is very important in terms of making sure that people know about the Health and Social Care Partnership and this new way of delivering services. Although it was discussed with officers and was talked about to some members of the IGB, it was never actually approved at the IGB. And I think there are some real concerns there. We talked about the winter maintenance, I've got to cancel that. Sorry, wrong hat on. The winter planning process, whereby that was circulated. We suggested at a development session it would be circulated to members, but it was then taken that because NHS Tayside members who also sit on the IGB had been at the IGB board and approved it, despite the fact there hadn't been 5 there, and for the IGB you need a majority to pass anything, that was taken as that was approved. And so councillor members and the ones who, the NHS Tayside member who wasn't there, didn't have the opportunity to approve that. So I think we need to get better about these type of things, need to have a formal process that, one, we have the input on the strategic direction, but also things that are fundamental to either the overall strategic direction or our responsibilities to approve things like the winter plan. There is a formal process to that. And things come either to the board, or that all of the voting members are contacted if there isn't time between board meetings to have a special meeting. Thank you. Okay,
thanks very much for those comments, Callum. I think is obviously a situation where, I mean, things can improve. You know, we learn and kind of can adapt our processes, procedures, but I think important points have been made. But I think certainly in relation to the strategic plan, if we have the opportunity to move forward on the basis of a draft, then that will perhaps help us to kind of pause and reflect and kind of bringing together a number of the issues, obviously, that have come through the budget setting process, kind of impact on the strategic direction, and perhaps just be able to clearly set those out in a strategic plan if we have a bit more time to do that. Drew?
Thanks, Robert. So, as your Director of Public Health, it's my job to make sure that my department and the specialist public health colleagues in my department give you as much support as you need in taking forward the next iteration of the strategic plan, particularly around issues to do with prevention, early intervention, tackling health and other inequalities, and in co-producing the change that's ahead of us. But I was very struck by something that our former Chief Medical Officer said back in November at the annual conference of Voluntary Health Scotland, where he was talking about a failure in public policy in relation to the voluntary sector, and he was describing really an investment and undervaluing by the public sector of the potential role of the voluntary sector in engaging in a completely different way with the population that we serve. And this is something that we had recognised when we published our health equity strategy back in 2010, a strategy for the whole of Tayside. So I suppose my question, Rob, is to what extent will we see in the next iteration of the strategic plan a much firmer commitment to, we have already a very strong voluntary sector in Perth and Kinross, but it can do so much more. And to what extent will we see that as a particular focus for additional attention and potentially investment as well?
Thank you, Drew. I mean, first of all, to assure you that our colleagues from Public Health have been involved in the conversations with each of the programmes of care. And yes, the broad principles that you set out in terms of looking at who and how we can deliver services differently will be a fundamental theme that sits throughout the strategic plan. Earlier, I emphasised to Claire the importance of the third sector and of communities in terms of delivering, and hence my comment about engaging communities in an honest conversation about how we deliver services in future. So yes, within the strategic plan, draft as it is at the moment and succinct as it needs to be, we will absolutely make sure that that theme is emphasised.
Karen?
Chair, thank you. 2 points from me, just following on from what Rob has said, Drew. The Chief Execs of Angus, Dundee and myself have asked for Scotland Excel to support a review of strategic commissioning in terms of the way that we actually commission services, and that's reaching into the health and social care partnership as well in terms of the way we commission services from the third sector. So that's the first point. My second point is slightly different, and it goes back to the strategic planning process. I would like assurance that we will have a robust equality impact assessment as part of the strategic planning process.
Okay, thank you for that comment, Karen. Colin?
Yeah, just in terms of the timeline, Rob, we've got the conclusion of the consultation. My understanding that's a public consultation. When's the start of the public consultation?
I'm feeling somewhat disabled because my colleagues who are dealing with the detail of this are not with me. However, I can get you an answer to that question, but I believe it's imminent. And the way that we're using our opportunity for consultation this time is through, we have people who are community engagement workers, and they are going out to target specifically the people who are already engaged and using our services.
Are there any further comments? Okay. Rob, thanks for your update. We've been asked in relation to this report to note the updates. Okay. Can I move us on to item 7.2, which is the Audit Scotland report, which was published in November. is health and social care integration and update and progress, and Rob has briefly outlined the recommendations within that report. You have a copy of the full report with the papers. I don't know, Rob, if you'd like to indicate how we would move forward with addressing the recommendations.
Thank you, Chair. Again, Councillor Purvis has already mentioned this report in terms of our discussion at the Audit and Performance Committee. This report sits alongside another document. Again, the Chief Executive of the Council has mentioned the Ministerial Strategic Group recommendations that have been published very recently. This report needs to be seen alongside that and alongside also the strategic plan. This review of health and social care integration sets out a few positive signs of the fact that health and social care integration is beginning to make an impact. However, what it also does is demonstrate that we are at a very early stage in the process of integration, and that there are certain functions which are not yet as integrated or working at the pace that Scottish Government would like to see. And I think we are now seeing, with the financial pressures that are appearing and the service pressures that are with us, that we do need to speed up the process of integration and working to make sure that all remaining barriers to progress are minimised. So what my report states is that we are in the process of looking at this document. We will bring together the MSG report, the strategic plan, and this document in order to set out our direction for the next period. Clearly, as I said before, this will be something that will be led by the new Chief Officer. However, the conditions that are set out in the audit report and in the MSG report need to be brought to the attention of each of the programmes of care.
Thank you. This also, I think, feeds into the earlier conversation about strategic planning. One of the issues that was highlighted as a challenge from this report is that engagement of the third sector. And we've had quite a discussion within Perth and Kinross around this recently as well at the Third Sector Forum. There's definitely a lot of willingness to engage on all sides. I think part of the issue is that the capacity of some of the smaller third sector organisations and even some of the larger ones to sort of spread ourselves across the groups that are there. And I don't know whether there's some ways of looking at other methods of engagement that maybe increases capacity for some, because what ends up happening is that there's a few people who do attend various groups and it tends to be the same people, and then we become quite thinly spread. So whether there is increased capacity or whether there are other models that we can look at that might maybe help to increase that engagement for those that aren't currently able to.
Claire, if I could just assure you that we see our consultation with the public being very important, and that we do this at various levels. So we obviously have the strategic planning group, which is a group of people, and you've been part of that. And we've also had the privilege of joining the Third Sector Forum at least a couple of occasions and having a very strong sense of engagement with the third sector. I completely understand the capacity issues for small organisations. And in a similar way, we meet different organisations in different parts of Perth and Kinross. So we seek to engage locally within our localities. And there is that idea of locality engagement. Then clearly we engage around specific topics, specific changes that we're seeking to make. But obviously our formal process of engagement with the stakeholder group is something that I think we could do better and we could do in a stronger way. Frankly, I think in the last 3 years we've been working very hard to meet the aspirations of the original strategic plan. And some of the reasons why engagement has been somewhat fragmented is because we've been trying to do a number of different things all at once. I think as we move forward and we have our programmes of care, we're going to have a far more concentrated conversation about what needs to happen in each of these areas that serve the people here.
Alistair.
It just seems to me that we're coming back to a theme that I'm very keen on, that we actually move into this locality concept. And my understanding is that there will never be enough money from health or from local authority So the third sector, the voluntary sector, the charitable sector, and above all, people helping each other and working for their own communities is vital. And I think that's where, as we review the strategic thing, we should be really looking at what's happening in each locality. And that's where the third sector can really play their part, because it's their direct interest in that bit. And I think one of the problems has been this quite high level, kind of meetings and just what you're saying, being stretched too thinly, whereas if people are focused very clearly on their own locality and we use the data that we've got to show how their locality is doing, then it's not that difficult to say, well, tick, you're doing great, or what is your problem, what do you need, and focus very hard on that. And I think it's absolutely essential to echo what Drew's saying, that we do really understand how these communities, these old parishes function, and really get a handle on what we can do to help them. Because if they're happy and the people in their locality are happy, it's so much easier all the way up, and it's got to be bottom planned. So I think this is a great opportunity to get that strategic plan really focused on the rich tapestry that is Perth and Kinross's locality.
Those are helpful comments. Thanks very much, Alistair. And I think, Drew, the information that public health would have would be able to be broken down into those localities, obviously highlight what particular areas might be a focus for any future work.
It can, and of course we have the Tayside Population Health Intelligence Network, of which Perth and Kinross IGB is part, and that allows us to add to the richness of the tapestry that Alistair's describing, because we can get access to data which isn't just the routine stuff we normally get access to, but from all of our public sector and third sector partners.
Thank you. Happy to approve the recommendations in this report. Thank you. Could I move us on to section 8 of our agenda, and 8.1, which is the Chief Social Work Officer Annual Report for 2017-18, and inevitably kind of time moves on, I guess, in terms of the production of these reports. But Jackie, I think you're going to briefly kind of perhaps, there's not a microphone there, can you shout?
Take one, please. Just take it with you.
And Jackie, I think your report obviously has already been considered by Perth and Kinross Council, but can I congratulate you on your report in terms of it's very informative, very comprehensive. I think such a helpful report in outlining kind of the work of, well, social work and social care, and the areas that you have responsibility for in a professional sense as the Chief Social Work Officer.
Thank you very much for your introduction there, Dr. Pete. This is a report, and I'm very pleased to be asked to present this to the IJB, but it's a report that covers the year 2017-18. And first of all, I need to thank staff within the Health and Social Care Partnership, because although it's a report produced in my name, I don't do this alone. It has had a significant contribution from Diane Fraser, who's unable to be with us today, all the service managers, team leaders and others in more central functions across the Health and Social Care Partnership, so great thanks to them. The report follows a format that is set out by the Chief Social Work Advisor to the Scottish Government, that's Iona Colvin in that post at the moment, and that allows key national themes to be reported. And the reports across Scotland are submitted to her for information only. It's not a performance report, and it's not analysed in that way. It identifies key themes nationally. And we were lucky this year on the 28th of January, to have Iona at a staff conference that we held on the theme of passionate and compassionate care on the 28th of January. So this report provides an oversight of the full range of social work and social care services across the local authority area of Perth and Kinross. So that's across all sectors. And it highlights what we're doing well, along with some of our very unique challenges, much of which we've discussed today, and I think this report touches on many aspects of the discussion that we've had already here as a board. It very much focuses on quality and impact, and I don't make any apology for that, because I think in its entirety it demonstrates the very positive picture at service level, team level and individual level. As a report, it looks back. So it looks back over the highlights of the last financial year, and we're just about to finish the current financial year. So in many respects, this report is quite historical, but it's important to bring it as soon as we can to the IJB because it provides that overview of performance of social work and social care services. It's also, I think, important to note that this report predates the comprehensive self-evaluation that Rob mentioned in his strategic update that was completed by the Health and Social Care Partnership between September and January. And therefore, anything, the rich material within that is not necessarily included within this report, but we'll pick up on that in next year's report. So the report covers a wide list of achievements against a backdrop of huge challenges arising from new legislation, policy direction, increasing and changing demands across all sectors, decreasing resources, as well as service design and transformation. I think the report clearly shows that our staff in social work and social care have not stood still, and that there continues to be a strong focus on improvement. The pace of change is quite dramatic at times. So though, sorry, I'm losing my, I think it's going forwards instead of backwards. Apologies for that. So though the responsibility for social work and social care services for older people and some adults is delegated to the Perth and Kinross Integrated Joint Board, it's important that elected members in the Council maintain a good understanding of all social work and social care services, and particularly around the statutory functions of the social work service. So this report was presented to Perth and Kinross Council, as you said in your introduction, Chair, on the 19th of December, and is very much an opportunity for elected members and the IJB to be assured that the statutory social work responsibilities are fulfilled, that they're satisfied that the service quality is being maintained, and that you're confident that risks are being managed effectively. So Chief Social Work Officer role is required by each local authority in statute and cannot be delegated to any other authority. And the role there is set out in this slide. It's very much set out in statutory guidance and accountable through local governance and arrangements for social care and social work, provides professional advice in relation to statutory social work functions set out in the Social Work Scotland Act, directly to the Perth and Kinross Chief Executive and elected members where required, provide professional leadership of social work services, support overall performance and management of corporate risk, and also professional advisor to the IJB. And it's important to recognise that the role within Perth and Kinross is taken alongside other duties, as my substantive post is Deputy Director in Education and Children's Services. So there are particular challenges around fulfilling that role when you're not directly responsible for or leading and managing operational services. So this report draws together information and data into one place about, I think this is really going backwards and forwards, about how social work services are being delivered, what's working well, areas for improvement, and to set out how change is being planned for and delivered. So I think the report overall identifies that very positive performance has been sustained, and that there is emerging evidence that investment in transformation is beginning to address long-standing pressures in some areas, and at the same time we're able to achieve aspirations for high quality care and delivery which is sustainable and which better meet the needs of our communities. And one of the examples within the report that is providing benefits already is the REACH project within Services for Children and Young People, where there's been a transformation, a review and a transformation which has resulted in the closure of our only residential unit for young people, and is already reducing numbers of young people who are being accommodated in residential care and producing substantial budget savings as a result. So in terms of the highlights within this report, I've highlighted there in bold those areas that are directly attributed to services for adults and within the responsibility of the Health and Social Care Partnership. And I think to be able to say from independent evidence and scrutiny that we know that we provide high quality care services for people with learning disabilities and older people, that we are continuing the upward trend in the numbers of people opting for self-directed support in a way that better meets their needs, that more people are assisted to remain in their homes in a way and provide quality support to avoid the need for institutional care, and that we're seeing people seeking help with substance misuse and they're getting the support they require more promptly, I think is our significant achievements. So the extent to which the social work and social care workforce is motivated and committed to high quality services is clearly demonstrated in this report. So nevertheless, there are significant and unprecedented challenges which are anticipated in the years ahead. And I think the discussion that we've had already today has touched on every single one of these. So they're not new, and they're rehearsing much of the discussion that we've had today. So this report was intended to be more evaluative and includes case studies as illustrations, and these illustrations give, I think, a sense of the impact of social work and social care services in transforming people's lives for the better. And I hope it gives the IJB some insight into the experience of the individual and the remarkable impact of our staff. Because although the social care and social work workforce continue to experience considerable legislative and organisational change, and that's set to continue over the next few years, I think this report is a credit to our highly skilled and committed staff who year on year embrace change, complex challenges and demands, and never lose sight of the social work values of service, social justice, integrity, dignity and worth of the person, and the importance of human relationships. I think their achievements, as set out in the report, indicate that we are in a position of strength in Perth and Kinross in taking forward the significant challenges over the next few years. I noted in your update, Councillor Purvis, that you intend to go into some of the detail of this at the next Audit and Performance Committee, so I look forward to some of the challenges around that. Thank you.
You had the invitation to go to Audit and Performance, so I certainly can go into the detail of it next week. There's another incentive for you to be there. But are there any general points that anyone would like to kind of put to Jackie this afternoon? No? You're happy to note the report? Jackie, thank you very much. And look forward to your next report. Okay. Is Claire here? Claire, would you like to join us? Thank you. Could I introduce Claire Mailer, for those of you that don't know Claire? Claire's here for item 8.2, which is the housing contribution to the Strategic Commissioning Plan, a statement of the progress that's been made there. So you're very welcome, Claire.
Okay, thank you. Thank you for inviting me along today to talk to you about housing's contribution to the health and social care outcomes. With only a short slot and obviously a hefty agenda, this is a high-level overview of some of our key achievements. Before I start, I think it's important for me to remind the Board of the important role that housing has to play in supporting the wider health and social care outcomes. Overcrowding, homelessness, dampness, poor neighbourhood condition, fuel poverty and social isolation can all have a very negative impact on a person's health and well-being, and lead to an increased risk of health problems, poor emotional well-being, poor general mental health, developmental delay, and poorer educational attainment. And I think the extract on the slide clearly articulates the positive contribution that housing can have on health and indeed on well-being. The local housing strategy sets out our key priorities and how these will be delivered. We aim to ensure that people can have good access to good quality, affordable housing of the right size, type, and in the location that they need. We deliver a comprehensive housing options and homelessness service, providing advice, assistance, information on the wide range of housing options that are available in the area. Through our independent living activity, we aim to ensure that people have access to the right type of housing to enable them to live as independently at home for as long as possible with access to support. And through the provision of good quality and energy efficient homes, we're addressing the impacts of poor housing and minimising the impacts of fuel poverty. You'll see the very many overlaps, I think, here in terms of the links between our vision and obviously the work that we do to support the delivery of the national health and wellbeing outcomes. So we have a target to deliver 150 new build affordable social housing units each year. Last year we exceeded this target and completed 161 new build homes for social rent. Within your report there is a link to a video clip about one of our new developments at Blackthorn Place. If you've got a couple of minutes, I really would encourage you to have a quick look at it. It provides a really good example of how good quality housing really impacts positively on the general health and well-being of individuals, of adults, but also of children. All of our new homes that we build meet or exceed the Housing for Varying Needs standards, ensuring that our mainstream housing is barrier-free, with the flexibility to meet the existing but also the changing needs of most households. Through our new build developments at Scone, Blairgowrie and Stanley, a number of homes were designed to facilitate independent living to meet the specific needs of households in the area. For example, the installation of wet floor showers, wheelchair accessible properties, automatic door closers, wet rooms. Properties have all been built to a high standard with a range of features, including assisted bathing facilities, additional bedrooms for carers, lower or adapted kitchen units, and structures to support the installation of hoists should they be required in the future. Through our allocations policy, we've significantly reduced our waiting lists. We used to have about 6,000 applicants on our waiting lists continually. We're currently sitting with just under 3,000, so we are meeting housing need in the area. We're tackling overcrowding, and we're supporting people with medical needs to move into more suitable housing. The need for collaborative working between homelessness and health and social care is clear. We receive approximately 1,000, last year it was 999 homeless presentations each year. Recent health and homelessness research in Scotland evidenced clear links between homelessness and poor health outcomes. The Scottish Government have also been very clear in their commitment and indeed their request for a more joined up approach between homelessness services and health and social care partnerships. And although homelessness is absolutely a really challenging area for us as a housing service, we've delivered some real significant achievements over the past year. Many of you will have heard of our successful Home First transformation project, and through this we've significantly reduced the reliance on temporary accommodation by delivering immediate, permanent and affordable housing wherever possible. So no longer are we placing homeless households directly straight into temporary accommodation, we're moving them into that longer term permanent settled accommodation very quickly. And by doing this, reducing or eliminating the use of temporary accommodation, we're having a positive impact on the outcomes for many households by reducing the stigma, the duration and indeed the experience of homelessness. I would have to say, blowing our own trumpet a wee bit, we have received some significant praise in terms of our Home First project, both at a local level but also at a national level for some of the really positive outcomes that we've been delivering. We recently submitted a rapid rehousing transition plan. All Scottish local authorities have been required to submit those to the Scottish Government last year. This was supported by our Health and Social Care Partnership, and one of our key initial actions now when we take the rapid rehousing transition plan forward will be to undertake research to gain an understanding of the local homelessness context and importantly the links with health to further inform improvements going forward. Our floating housing support service enables vulnerable people to live independently and to maximise their independence. We provide short-term personal outcome focused support on a practical and an emotional level to support people to live independently in their own home. The Care Inspectorate awarded us excellent grades last year for the quality of care and support and for the quality of staffing and leadership. Oh, I've gone too far. Last year we appointed an Older Persons Project Development Officer within our housing service to support us to respond to and meet the many cross-cutting issues affecting older people. We've recently launched and developed a housing options guide for older people. This provides a range of useful information, including details of home care services, our care and repair service, assistive technology, selling and buying, renting, retirement housing, sheltered housing, and amenity housing. And it's enabled us to provide individuals with housing information which assists them to make informed choices around their current but also their future housing needs. And it also ensures that we're planning our service to meet the challenges of an ageing population. We understand the negative impacts that household high housing costs can have on a person's health and well-being. We've recently developed a rent affordability model, and our rents, our social rents here, remain the most affordable in the area, in fact one of the most affordable rents in Scotland. Compulsive hoarding is challenging to treat because many people who hoard do not necessarily consider it to be an issue, and they often have little awareness of how their disorder impacts on their life but also on others, and it's often associated with anxiety and depression. During 17 and 18, the Housing Service led on the introduction of a hoarding protocol in partnership with the Scottish Fire and Rescue Service and again in partnership with our health and social care colleagues. And at the heart of this collective approach is very much a person-centred focus to support and help tenants regain control of their homes and their lives. Whole range of activities that we do there in terms of engaging with tenants, and our tenants are very much involved in influencing the way we deliver services. So there's a range of tenant participation opportunities throughout the services that we deliver. Quality of home, obviously that's absolutely key. Poor quality housing, as we know, can have a negative impact on a person's health and well-being, and we're progressing a wide range of measures to support the provision of good quality housing in the area. Our overall investment on our capital improvements to our properties over the last 5 years has been over 93 million. 96% of our stock meets the Scottish Housing Quality Standard, that's above the national average, and we have very high levels of tenant satisfaction with the quality of their home. In fact, we were top in Scotland for tenant satisfaction on that particular indicator last year. And as you can see, we're progressing a wide range of measures to improve the energy efficiency of our homes, minimising fuel poverty wherever we possibly can. Sheltered housing. We manage 7 sheltered housing complexes, providing 190 homes to older people throughout the area. Last year, we invested just shy of £1 million in terms of capital refurbishment programmes to 2 of our bigger units within the city centre. This included the construction of a new sun-glazed sunroom, landscaping, exterior lighting, seating areas, assisted bathing facilities, new designs to make the circulation spaces brighter, safer and more comfortable to move about in, to assist the residents, and particularly residents with dementia. Wide range of interactive sessions that we hold within our sheltered housing units, and we extend these not just to our own residents but to residents in the wider community. So care about physical activity, cooking sessions through our Zero Waste project, intergenerational activity with the schools, and so on. There's a wide range of work that we undertake. We've expanded the use of technology-enabled care by the expansion of the Smart Flat to enable people with learning disabilities to enhance their independent living skills. Through care and repair, we aim to ensure suitable housing and support to prevent hospital admission and deliver that seamless service for people who are discharged from hospital. We provide a garden maintenance scheme to a large number of tenants. A review of special needs housing was informed by feedback from over 500 stakeholders. The findings were really clear that the current accommodation with support options are highly valued by the people who live there. And overall, the feedback was very, very positive. We have, however, established our independent living group in partnership with the our health and social care colleagues, and the recommendations from that review have been themed into the work streams that you can see on the slide. We're progressing these through the group, very much about planning ahead and identifying need, ensuring that we've got clear, effective processes in place to facilitate a person's pathway into appropriate supported housing, maximising successful transitions, and ensuring that we have the appropriate provision. Not just now, much of the discussions today has been about, are we planning ahead in terms of the future? So that's a big piece of work that we're progressing. Again, challenges very much mirror the challenges that have been discussed this morning, that we need to collectively address to support people to live at home for as long as possible. As we've discussed today, these are very much round and about the changing demographics, particularly relating to an ageing population, increasing demands for adaptations to existing homes, the increasing range of complexity of requirements for housing support to help people live independently in the community, and the need for a specific health and housing focus on vulnerable groups, such as those listed there: homeless people, people with mental health and drug and alcohol issues. The report throughout details a large number of actions that were taken. These will be factored into the strategic plan, but here you can see some of the next steps that we intend to progress in the forthcoming year, and certainly that forward planning in terms of the collation of robust housing support and care needs on current and future demands will really enable us to start doing some more strategic plans for the future. For us, for our new build developments, from project site identification to the land being shovel ready, takes a number of years, and it's really factoring this in as we go forward. So hopefully you'll see that's a sort of a flavour of some of the work that we're doing, quite good impacts in terms of the health and social care outcomes. We will bring further updates, probably on an annual basis, to the IJB as we go forward.
Thank you very much for your presentation. It's obviously lots of developments over the last few years. It's really good to read them and to hear about them from you this morning, and a very positive contribution that you make to the work of the partnership. I think, as we all know, the quality of persons' accommodation can make such a difference to their general well-being and the opportunities that they have. So it's really good to hear of some of the work that has been taken forward. Are there any questions that anyone has? Please come and have a seat. Any questions or comments that anyone would like to make in relation to Claire's presentation? Eric?
Thank you. Yeah, I mean, thank you for that report, Claire. It's extremely positive and a lot of really good work being done. The issue of isolation, loneliness, in particular in rural settings and their more remote communities and so on, is obviously an issue. And sadly, I think there was an instance of a lady who died, and in an isolated setting within Perth and Kinross. Can you give some sort of assurance that the work that you've described here is being done across the whole of Perth and Kinross, and not simply focused on the larger urban communities and suburban communities?
Yes, absolutely. I mean, you can see in terms of the sheltered housing that we've undertaken refurbishment in two of the city ones. But within our sheltered housing, I was recently out at Duckledge Court in Crieff, for example, popped in there, and a very good example of the sheltered housing support officer there bringing in some of the wider community. And it wasn't just our own tenants, there were a number of members from the wider community. In fact, as I was circulating there, within the coffee morning that they had, there were a good number of community members that had come in from the wider surrounding area, had been supported to come in and were participating not just in that coffee morning, but clearly in a number of the social events that are being organised. That is absolutely something that we want and will continue to promote. And, you know, my big ask to health and social care partners is, you know, we want to make sure that these facilities are very well used, as with the assisted bathing facilities or communal areas, and would continue to encourage colleagues to encourage their clients to do the same.
Thank you, Claire. That was a great presentation. And I was so pleased when your first slide quoted from a report from the Scottish Public Health Network, which I led for the first 6 years of its existence. And it makes a really fundamental point about the importance of housing. I mean, you've referred to a whole range of particular initiatives and aspects of the service which support the whole health and social care integration agenda. But I think the relevance of housing is so fundamental. About 75 years ago, an American psychologist, Abraham Maslow, described the 5 fundamental requirements of humans, including food and water and rest. But 2 of those were around shelter and warmth. If we don't have shelter and warmth, if we don't have good housing to facilitate that shelter and warmth, we can't have health at all. So as well as all the things you've talked about, getting the housing aspect of the public health agenda right through the work that you do and the work you do with partners is fundamental to maintaining the health and well-being of the whole population of Perth and Kinross.
We're asked to note the contribution that you've made over the 3 years, Claire, and also to instruct the Chief Officer to ensure that we integrate the contribution that housing makes into future plans. Are you happy to approve these recommendations? Okay. Claire, thank you very much for coming along to deliver your presentation. Could I realise I haven't got you to your lunch at 12:30, so we'll kind of try and speed up. And Jim, I realise I know you were outside for a while. Could we take item 8.5? I know it perhaps won't help you an awful lot, but if we could deal with it now, it might enable you to go on and do other things, if that's okay. I think Hamish and Jim, Evelyn, we're going to present this report. We'll go to item 8.5, which is the application to amend the GMS contract to close the branch surgery premises at St Maddo's for the Carse medical practice in Errol.
So I'll do a brief introduction, if that's okay. So this report is written today not in relation to the IJB approving variation in the contract, because that has to be an NHS Tayside approval process. But we thought it was really important to share the journey we've been on. It's been a very complex journey, and the ability to sustain a GP practice in the middle of that has involved many of our stakeholders around this table, including our work with NHS Tayside Primary Care Services, PKC Planning Department, our local councillors and our GPs themselves, who put a lot of effort into this. So we wanted to really to be able to share the complexity that the IJB board need to understand around sustaining primary care services and being able to do that moving forward. So Jim's going to take you through sort of the journey so far. There is one approval on the paper that we need to ask about, but we'll come to that. Where is he? Oh.
Okay, thank you. It's okay? Okay, thank you. Thanks, and good afternoon. Given time, I don't propose to go into the detail of the actual report, but the purpose of the report is to ask the board to note the application which has been made by the practice to close their branch surgery in St Mary's in accordance with the various NHS regulations. Support the aim of the practice that the current patients will have the opportunity to remain registered with the Carse medical practice and continue to see their own GP practice as they see currently. Note that the preferred option for the practice is to consolidate its services on one site and to maintain the long-term sustainability of the practice. The approval, which was referred to, is to seek approval to further consult with the GPs and the GP practice population to inform a health needs assessment that will support the development of a new practice facility in the area. Excuse me. There has been a GP practice in Errol for over 50 years now. The current GP partners all joined the practice in 2014, and that was following a period where the practice was unable to recruit new GPs, which gave a lot of cause for concern at that time. Errol has always been the main centre of the practice, in the same way that St Mary's has always been near the branch surgery. From 2016 onwards, the practice has been looking at the long-term sustainability of the practice, given the history, and has included the future of the branch surgery in St Mary's. The practice has informally engaged with the patients, mainly opportunistically during consultations and other issues about the long-term sustainability of St Mary's itself. However, events overtook that process, and a number of unexpected and complex circumstances befell at that time. These included the termination of the lease on the premises in Errol itself, changes in the financial arrangements for GPs and their contract arising from the new GP contract, where the responsibility for premises was taken from GPs themselves to individual health boards. Subsequent to that, a number of failed attempts to provide new temporary premises in Errol unfortunately didn't materialise, and the outcome has been that the practices had to move to even more unsustainable accommodation in St Mary's itself. Additionally, the Health and Social Care Partnership, with support of primary care services at NHS Tayside and Perth and Kinross Council, have secured a 5-year interim solution whilst engaging, consulting and designing a new longer-term facility in Errol. So a lot of time and effort has been invested in the consultation process through the potential or proposed closure of the branch surgery in St Mary's. That has been undertaken through a prolonged period of time. At the end of the day, the conclusion from the outcome has been that the patients were very happy following information from the practice about their full proposals, rather than just propose to close the St Mary's branch surgery. And the GPs have asked if I can convey to the board their thanks to Councillor Bailey for his time and support that he offered to the practice during this period. So after an average 2-year period, the practice is looking forward to continuing the provision of safe, thriving and sustainable services in the practice that are more appropriate and more sustainable for the patients for many years to come. And I'm very happy to ask any questions. Answer any questions.
Thanks very much. Amanda, would you like to come and to the table? If there are any questions that anyone has with regard to the paper and what Jim has said to us this afternoon. No questions, so we're happy to note and agree with the recommendations, noting that this will, for approval, will go to NHS Tayside Board, but also that we would want to kind of support the further consultation with regard to kind of GP premises into the future. The board happy to agree that recommendation? It seems yes. Jim. Okay, thanks very much for coming along. Can I take us back to item 8.3? It's strategic program of care boards, the terms of reference for those. I don't know if Rob wants to say anything. I think we're being asked to approve the terms of reference. Is there anything else you would like to say about them, Rob?
No.
No. People happy to approve these terms of reference? Evelyn?
I suppose I would just like to know.
I think there are too many microphones on. There's one behind as well.
I'm on now, okay. I think it's important to note the comment that Claire had made earlier around the role of the public partners, engagement and the complexity of our planning arena in terms of how we encourage people to participate and to look at new ways of working and new roles. And I think we need to give a commitment as programme leads to have that conversation moving forward and what that will look like moving down into locality, consultation and engagement as well. We've already started that conversation as part of the Mental Health and Wellbeing Board and absolutely happy to take that forward with the other boards as well.
That would be helpful, Evelyn, if you kind of would do that, Claire.
It was just to add to that, there are no third sector representation on the primary care board, and whilst I understand there's probably not a direct need, but the third sector being a pathway for social prescribing, it might be a challenge if there's increased demand that can't be met. So to be part of those discussions might be helpful.
I was going to mention membership as well, because it seems to be inconsistent where it refers to public partner representation but doesn't specify if it's carer or service user or both. And in other memberships it says carer representative but it doesn't mention service user representative, and it's just to have a clearer picture of who's going to be attending.
So I think maybe just to respond to that, I do think that the boards are all slightly different. And if we take the Mental Health and Wellbeing Programme Board, for example, we've got 4 strategy groups sitting underneath that. We wouldn't be expecting to change the membership in terms of users and carers and third sector representation. So we just need to have that conversation and be clear what the ask is of you and what would work best for us all. So I'm happy to take that forward with Diane and Hamish and whoever else. So.
I think yesterday at the workshop we had, when we were trying to define who should be, what the membership of the strategy group should be, we had carers included in that, and but service users, not to be actually members, but just to be consulted with. Whereas I feel that there actually should be a service user. I mean, these are the people that the services are being delivered to, and they need the opportunity to discuss that round that table rather than being consulted with and then that's it done,
Can I just ask what the workshop is that Maureen's referring to?
Sorry, the workshop to define the strategic planning group, the membership and actually the role of the group. So it's in regard to the membership.
So if I could clarify that in terms of, we had a workshop yesterday in relation to the Mental Health and Wellbeing Board, because one of the aims of the board is to review the strategic planning groups and to look at our review the membership on that. So we wanted to be clear about, number one, the cross-cutting themes, so that we're not actually strategically planning in silos across the Mental Health and Wellbeing Board, and we got some really good progress on that. But we've also looked at the structure of the boards and the representation. So that will be written up and will be available for people. But that's what Maureen's referring to. It's not the overall strategic planning board.
Okay, so we have the terms of reference. I think if we could, yeah, I will in a moment. If we can get an assurance that the involvement of people who use services and carers has been considered by each of the programmes, and I think we would want to see that reflected in not only the terms of reference but obviously the reports, the ongoing reports that we get to this board. So we look forward to seeing how best we can involve full range of partners in the work of the programmes. Colin?
Thank you, Robert. It was just to get a quick assurance. When I saw the prior draft of these terms of reference, they're all the same. They've got just before the reporting arrangement diagram at the end, they have a section on strategic priorities. The Care Board, doesn't matter which one it is, the Care Board will identify the priorities for progression and direct additional tasks when necessary. I just want to understand or be reassured that the programmes of care boards are not setting strategic priorities for the Health and Social Care Partnership in line with the discussion that we were having about the strategic commissioning plan earlier.
So my understanding of the role of the boards is that they will propose potentially the strategic direction and priorities, but that will be signed off by the strategic planning group, or board, sorry, but consulted with the strategic planning group.
Yeah, so strategic priorities go to a board, but not to the IJB. This is the fundamental issue. Strategic commissioning plan is the IJB's. That was the point that Councillor McDade made earlier, and I see him nodding along again at this point.
So if I could just attempt to try and sew this together. Clearly, the people who are delivering services have to take into account the pressures on their services and look at innovation and best practice, high quality, safe and effective services. They understand that in detail, and the programmes of care boards have been brought together in order to explore the possibilities for modernisation and change. The reason that they've been brought into place was that our previous planning structure under localities was fine for the needs of a local population. But in terms of setting out the scope for change within the delivery of health and care services, it was found wanting, and we had to bring ourselves to a point of understanding these 4 programmes of care that are fundamental to our core operations. I absolutely accept the point that Maureen, Linda, Claire have made, but throughout this we have cross-cutting themes for everyone. And the reason we have a carers programme board is because there is a specific obligation on us as a health and social care partnership to consider the needs not only of the people that we serve directly, but in looking at supporting that very important network of carers that actually do the vast majority of the caring work in this area. Over the 4 programme boards, we have a strategic planning board which is made up of the exec officer team and a number of additional professional and departmental experts. And they will be agreeing across the 4 programme boards the balance of where the emphasis of the partner should be. And their job is to bring to the IJB proposals for the IJB to consider. So this is about setting out very clear proposals for the IJB to make decisions on. In terms of how that process is influenced, clearly we already have evidence from the discussion this morning and from previous discussions that our IJB board members also have an opportunity to input into that process.
In conclusion. Can't even say the word. Callum. That's not in conclusion, but Callum, a final comment.
I just wanted to pick up on the issue about the bringing forward the recommendations, and it's something that I and my colleagues have mentioned in relation to the council as well, that yes, you'll bring forward presumably a recommended option, but it's also very useful if we can see some of the other things that you've discussed and your rationale for discounting those as well, so that we're able to come to an informed decision. And yes, if we agree with your recommendation, that's fine, but we'll be doing that from a position of knowing the other things that you've looked at as well. And one tiny little parochial thing, as a ward councillor, I have raised this before and it hasn't been corrected. On page 217, could the South Perthshire locality be changed to the South Perthshire and Kinrossshire locality? Kinrossshire is not in Perthshire. Thank you.
Could we do that at the end of the meeting, please, and you get clarity as to the change? We're not going to approve the term. Well, my suggestion today is that we're not going to approve the terms of reference, but we'll have a further look at it in terms of the wording, so that there's clarity in relation to the wording and the role of the programmes and the accountability to this board. So if we could do that and bring it back to the next meeting when hopefully we will be able to approve the terms of reference. Thank you. Okay, it's 9 minutes to 1. We are going to finish at 1 o'clock, so there's a challenge to you in this next paper. Rob?
So we did actually have a plan to give you an update on the carers programme today. This is about looking at the progress on each of the programmes of care. And we have brought together the update reports into a single paper rather than having 4 separate papers today. Chair, would you like to see the proposal, the presentation from carers?
Sure. Is it,
yep.
Is it a fairly brief presentation?
Is it brief, Karen?
No, sorry, I hadn't been aware that you had a presentation as such. No, please come and deliver your presentation.
We just felt it was important to allow board members to see the progress that has been made in one of the programme boards.
Okay, no.
So if, Karen, you could do that concisely, that would be helpful.
So I'm Karen Sharp. I'm one of the service managers within the Health and Social Care Partnership, and I'm also here with my colleague Raymond from PCAVS. So we thought that we thank you for the invite today to come along to speak and give an update in relation to the Carers Programme Board that went into place at the end of September last year. So I suppose where we would start would be, we're aware that there's a Carer Scotland Act 2016, but moving that on from that Act, from April 2018, we know we now have a duty to provide support to unpaid carers. So where initially it was about assessment of the carers, that moves on to the individual person having the unpaid carer having an individual support plan. So what have we been doing? So the carer eligibility criteria was delivered and put in place in February 2018. And just now we have an existing carer strategy that has come to the end of its lifespan. So through consultation and involvement from lots of different stakeholders, we have reviewed the existing strategy to then take things further forward locally for Perth and Kinross. The draft went out yesterday, and once we have the final comments back in, that will then influence what the final version will look like. Additionally, one of the important things that we required to do in relation to the Act was consult and develop a short break services statement, so people are aware of what their rights are as a carers, and also know what is the landscape out there and how that responds to them in their time when they need support to continue with their caring role. So that was, again, consulted on. Then the design came from that, and that went live at December at the end of last year. We've published that on the PCAVS website and our own website. From there, what we said was we would review it every 6 months. So we've already put that commitment to the short break services statement. And already, and quite rightly, we've had feedback saying websites are great, but actually we need lots and loads of communication. So we're about to put forward a leaflet in places that we have been informed, Raymond, that from shops to GP surgeries to just natural connecting places where people can find what this is about and what that means to them if they recognise themselves as an unpaid carer. And as we know, that is often something that people don't recognise themselves as are. So the further reaching with the communication that we can have, so people have that awareness, can reach out for support when they wish or require, the better. So the implementation of the Act, we are on course to meet the requirements of the Act. And throughout that journey, for example, we met as a stakeholder group just this week in relation to further consultation that often happens throughout implementations of acts, and that was in relation to the timelines of support plans that would go in place, for example, when it actually involved terminal illness. So we will all understand the importance of that being very much timely and appropriate. So already the stakeholders from the board gathering together at these points. The return for that to the Scottish Government will be on the 12th of April. So there's lots of things that we're already working hard on. The delivery, as I've said, we had a strategy that came to a refresh point and a review point. So our next strategy, again, will be over 3 years. The personal journey, well, that speaks for itself in my mind. Well, I mean, that is a personalised experience for people. And to give an update, from April 2018 to January 2019, we have assisted the development of individual support plans. 659 plans have been developed for adult carer support plans, and there has been 80 young carer support plans developed. Because what I need to mention is this quite an ambitious strategy going forward with a supporting action plan, how that translates into localities. What does that delivery look like in response to people's lives? That will be a young and adult carer strategy. Okay. So, what, oh, is that the right? No, yeah, thank you. So, crucial to this is the engagement and collaboration with carers. I've heard that throughout different discussions today. This is no different, can't be. Working alongside personal law councils, we have representation on the programme board and the strategy. We've all joined together in relation to children's services and children family services. We know that often the youngster will grow up and become the adult carer, but making sure that how we intervene ensures that they also can have their own life alongside all these different responsibilities. Awareness campaigns, that will always be an expectation, and we have had the Carers Conference. We've, as I say, involved in this most recent consultation, and that will never stop. It shouldn't stop. We are reviewing working arrangements. What I mean by that on the slide is the processes, what we do as the workforce, and everything should be about the improvement journey. Support and development in relation to interventions, and that could be technology. Often people feel that that is less intrusive. That will be many interventions that we take, but we have invested in the technology-enabled care area. Data validation, in the lifespan of the programme board, we have had 2 returns. The last data return that is presently in hand just now to inform Scottish Government what's happening locally, it actually had more asks of our workforce, so there's more questions to have when you're having that natural conversation with that unpaid carer. So ultimately, when we feed that into, and to make sure we remain data rich, to understand locally and how that translates back, we have to then, well, we are having to respond to that and how we input that into our social worker frontline systems. So what are the responsibilities of the Health and Social Care Partnership as we sit around the table today? To publish an eligibility criteria by April 2018, to offer adult care support plans, as I've mentioned, for the youngster to the adult, and the statement that that supports, and as I said, we will review that in 6 months, so any and all feedback is always welcome. To provide a short break services statement by January 19, which I've covered, we have done, and to develop a joint carer strategy, the lifespan being 2019 to 2022. And obviously that is to be timed in line with the new strategic commissioning plan. So, most importantly, what are the rights for carers? To be offered an adult carer support plan or young carer statement, to be involved in the development of their own support, because as I started at the beginning, the personal journey, the personal experience. Us being mindful when we become involved and when people possibly want us to step away as well. It's a movable feast, and quite rightly it should be. Involvement in hospital discharge planning, and my colleague Raymond will explain one of the investment areas that we're already further responding to. That came from the programme board at the end of the year in relation to hospital discharge planning and what that response looks like. Support for bereavement, or when a person who is cared for enters permanent residential care. I don't think anyone in the board on the strategy or the people's lives we're involved in, it is about keeping families together at all times and how we support that. And quite rightly, people to be consulted and listened to, which then informs the planning decision and how that then translates into service delivery across localities.
Okay, thank you, Karen. Just to, I guess, expand on a couple of the points in this slide, we're aware that the hospital discharge and the hospital link worker is predominantly based at PRI at the moment. Trish Allen, who's commissioning officer, is very keen to have conversations as to how we can expand the reach of that particular post, because I think it's needed. So there are conversations that we're about to start with Trish going forward as to how we can expand the reach throughout the whole of Perth and Kinross around the hospital link worker role. I'm also having conversations with colleagues at the carer centres in Dundee and Angus around Nine Wells, because we're aware that there are obviously some residents, and particularly in North Perthshire, who will go to Nine Wells as their first point of call. So we're having conversations around how we can raise awareness at Nine Wells as well. And on a slight tangent, but I guess it's still health related, I've got a kind of aspiration is to try and get the possibility of a small business card type information card that we've developed at PCAFs, which is basically, aspirationally, is to have it in all GPs' desks in Perth and Kinross, because I feel that an older age group in particular will listen to their GP probably even more than they'll listen to their family. So if a cared for person goes in and the carer's there and obviously quite frazzled and needing of support, what we would ideally like is for the GP to hand the carer the card and say, go and contact PCAFs and see what support's out there for you as well. So through Lindsay Bailey had managed to get us the contact details for the GP cluster lead meeting. We couldn't unfortunately get in on January because it was a full agenda, but I've had a promise that will be an opportunity to present there in the next time that the meeting meets. So we'll keep you advised as to how that progresses. The fourth point on there, and I think for me it's important that you listen to carers, because a recurring theme that we kept picking up from carers through our support workers was they felt that when the cared for person had passed away or even had moved into full-time residential care, there was an equal feeling of bereavement. They felt all the services left and they were left to cope on their own. Now, there was a bereavement type group that was delivered through the council, but I think when Rosemary McLean retired, it fell by the wayside. So we've got a support worker at PCAFs who retired after 17 years with us. He retired last summer, but at the moment he's now put together a support group called the Bridge Project for bereaved carers, or for carers when they've cared for moved into full-time care. Now, to give you an example, of the first meeting, we sent out 22 letters to carers inviting them along to this peer support group, and we had 14 that appeared, which is a really positive take-up. And since then, the next two meetings as well have had similar numbers and new carers arriving. So that's something, I guess, that we listened to what carers were saying was a gap for them, and we tried to fill it. So I guess 2018 was a big year in terms of consultation. There was consultation around the eligibility criteria for young carers and for adult carers, consultation around what the young carer statement and the adult carer support plan should look like. There was a consultation around the short break statement. And then finally in October, the big consultation around what the adult carer strategy should look like. So there were key themes that are on the screen just now that I don't need to read through for you, I'm sure. But the consultation that we did in October got 320 responses from all ages of carers within Perth and Kinross from all areas, and highlighted specific themes that are, as I say, are up on the screen just now. We then took these key themes to the carers conference that we delivered towards the end of November at the Dewar Centre, and looked to kind of develop those themes a little bit further. And from that, that's where the draft strategy is at the moment. That I think it was sent out yesterday, I think now for consultation. So A lot of what you'll find within the draft strategy and the action plan has come from the consultations that we've done over the past 12 months. And there's a second. So how we support carers, I've got a couple, if you've got the time, very, very brief examples, but it doesn't always need to be a huge sum of money that it takes to make a difference to a carer's life. 2 examples. We had an elderly lady of about 80 who approached us and wondered if we would give her £80 to buy a new battery for her husband's electric wheelchair because she was too frail to push him about. We got her the battery fitted, and the feedback that we've had from her is, you know, it's now the two of them can get out and about together, and it's made a massive difference to them. A second example, we had a 75-year-old lady who approached us wanting money for driving lessons. We thought, a bit strange, dug a bit deeper. Turns out, to cut a long story short, the husband's got severe dementia. Taking the husband on public transport to go and do her shopping was becoming a nightmare. What we basically then did is we bought her a laptop and set up a Tesco shopping account for her so she can get her shopping delivered instead of having to go out and about. So that cost £250. So those are the type of things through this flexible short breaks that carers can apply for. Part of the funding comes through a national carers organisation called Share Care Scotland. We usually get about £16,000 from them every year. And then over the last 12 months, we've had top-ups, very well received top-ups, I would say, as well, from the local authority to allow us to develop that further. We have other initiatives through national carers organisations such as the Carers Trust. We've got Respitality, which is a hospitality and respite initiative that we deliver in partnership with Share Care Scotland. So that matches carers with respite breaks. Complementary therapies are still really, really popular, both the ones that are delivered through the local authority, and also we do communal social type therapy sessions in 4 areas of Perth and Kinross just now. And obviously training and development opportunities, not just for carers, but obviously for cared for and professionals as well. So I guess the headline news for us at PCAS, and we're thrilled and probably like to put it on record, thank you to the local authority for their assistance around the leasing of what was Lewis Place Day Centre. Had it not been so favourable in terms of the rate, then I think it might have been out with PCAS as a position to be able to do this. But we did take the keys for the days for the centre on the 1st of December. We've signed a 5-year lease. We have been spending the last couple of months, particularly around the public areas, giving it a little bit of a refurb and a bit of a spruce up. Currently getting the wiring in for the IT, and the hope will be that come the 1st of April, the carers element of PCAF services will be delivered from this new carer centre. The hope will be that the Provost is very keen to come and do a ribbon cutting event on the 1st of May, so obviously we'll make that a joint event to acknowledge the support that the Council has given. And we're hopeful between April and May that we'll have the opportunity to do some open days with professionals also, as well as carers. I think we need to with professionals in particular as well, we need to let them know what it is that PCAFs delivers. But there's also going to be a fantastic, I think for us the main element is the increase of the use of services. So the Young Carers Den can reopen as the beauty salon and so on and so forth. I've already had conversations with Support in Mind, with Perth College, with New Rannoch Day Centre, with Tech at Perth and Kinross around how we can all work in partnership going forward. So I guess it'll be branded PCAS, but we'll really see it as being a joint opportunity for everybody. And I know I'm very aware of time, so I'm not going to go on too long, but first I'd just like to say thanks to Ina for allowing us to tell her story. If I can give a very brief history around the telephone service, because I think it's a really good news story. About December 2017, when Paul was the lead for carers, he asked if PCAS could do some focus groups with carers and asking how can you best be supported, or how could you be better be supported. And it was particularly aimed at carers where the cared for was aged over 65. Anyway, cut a long story short, when we did the focus groups, one of the recurring themes was someone to talk to. Let's give somebody to have a chat with and an opportunity to maybe talk about how we're feeling about things. So we recruited 2 girls. They basically started with support plans at PCAFs and started cold calling, introducing the service really. And as of today, we've got 154 carers who get regular phone calls, and the girls make over 400 phone calls a month. Now, a couple of advantages to that we didn't even foresee when we set this up was A, the number of times that they made initial phone calls and realised this person's support plan has not been looked at for years and is really probably not fit for purpose anymore. So that was fantastic because that allowed us then to get your referrals in to get more up-to-date support plans. But the second thing was as well, these regular phone calls allow us to keep on top of the caring situation, and then if the situation deteriorates, there's that opportunity to get in earlier and hopefully, you know, stop the situation from deteriorating. So, yeah, as I say, you can see from Ina's story, she was referred to us in 2009. One of the girls at the service picked up the phone and had a wee chat with her. Ina's another one where it was just a small amount of money, but it's made such a massive difference to her because she was looking for a tablet in order for her to do shopping, to keep her mind active and so on and so forth. So we put her in touch with Lead Scotland to give her a wee bit of how to use IT and the likes, and then from beyond that, we, through the Time for Me pot of funding, got her a wee laptop as well. So that's been a fantastic positive experience, I think, for Ina. So I shall shut up now and let Karen maybe say the final word.
No, I think, to me, that's the most respectful moment to actually end on, and I think that that'll resonate with us all, that it shows what can be done and it shows what can make a difference. So thank you for Ina for allowing us to come along and share with you all what is her now experience, and this then supports Ina to continue to have an unpaid carer's role, which is what we all in the room would wish for people. Thank you.
Can I just ask one? Sorry. Is it volunteers that make the phone calls to these carers, or is it staff at PCAVs?
So last year the local authority piloted the scheme to the tune of £40,000. So it's 2 paid members of staff. We do have 1 volunteer as well who helps. I guess with those numbers, ideally we would look to be expanding, because obviously if you're getting those numbers and beyond, then you know it's making an increasingly large workload for the girls. But yeah, it was funded by the local authority.
Jackie, you wanted to ask?
Yes, it's just thank you very much, Karen and Raymond, for your presentation, and it's really gratifying to see the progress that you're making with this work, and the really valuable support that's resulting for both adult and young carers. And I know you mentioned in your presentation, Raymond, I'm struggling to look at you and speak at the same time, the Barbara Vaughan legacy, Councillor
Yes.
Barbara Vaughan, who
Yes.
was wholeheartedly and persistently supporting young carers throughout her tenure here in Perth and Kinross, and certainly in my employment here. So it's great to see that the legacy and the funding that's been provided is going to such good use. But one of the things I wanted to raise for the board here is that the responsibility for the strategy and the eligibility criteria and the young carer statements for young carers rests with the council and not the IGB, so we need some clarity on that. So if the strategy is coming to the IGB in April, it must simultaneously be reported to the Lifelong Learning Committee, who would have responsibility for that, because it was the Lifelong Learning Committee that approved the existing arrangements for young carers in March or April 2018.
Okay, thanks for clarifying that. Okay. Colin?
Thank you, Chair, and thanks for your presentation. I wanted to refer back to the slides where you talked about the consultation outcomes and what carers had said during the consultation process. And I wanted to understand, I would have not called those outcomes, I would have called those responses or arising themes. And what I am interested in is outcomes. What I'd like to know is those themes and responses that were presented, or that came out of the consultation, how are they turned into action in order to respond to the points that were raised?
I think the themes on the action, or for the strategy and the action plan, I think there's 5 headlines that the themes identified, and within each headline there is a pretty comprehensive action plan that's been set in place around how we're going to achieve those. It might be, I guess, when you get the opportunity to have a look at the strategy now that it's been put out for consultation, that maybe be a bit clearer.
Thanks very much.
Okay.
Karen and Raymond, thank you very much for your presentation. Sorry, I kind of at the outset was going to limit your time. I think we recognise, I mean, the fundamental importance of carers, you know, the contribution that they make, and also the importance of trying to reach what would be described as hidden carers, people that perhaps haven't been able, don't know where they can receive support, nothing hearing about the cards for GPs. Obviously, probably everyone at some point will go to the GP, and maybe increasingly for carers who are supporting someone who may have health difficulties, and certainly would look forward to kind of seeing more from the draft strategy. So thanks for your presentation this afternoon. Can I also say the other programmes of care, I think we'll obviously hear more of those as the strategic plan is updated. And again, if you wish to come to the Audit and Performance Committee, you'll see that the details performance from the programmes are also going to be addressed at the Audit and Performance Committee. You're happy to note the recommendations in this report, which takes us to item 9. 9.1, 9.2 are for your information. 9.1 is public bodies climate change duties, and also you have a copy of the Standards Commission for Scotland update from December. So you're happy to note both of those. And item 10 are future meetings. You'll see a note of those, and our next is an additional meeting on the 22nd of March, so we look forward to seeing you all then. Thank you all for your attendance, and thank you for all the contributions this morning and into this afternoon.